Government has officially launched the home-based care and isolation guidelines, making Kenya the first African country to adopt the system. Speaking at Afya House Wednesday evening, Health CAS Dr. Rashid Aman said that 78% of infections in the country are asymptomatic and can be monitored at home. This as the government seeks to decongest isolation facilities in the country. David Mudoka reports.
The country has taken a different trajectory in the handling of positive COVID-19 cases following the launch of home-based care and isolation guidelines that take effect from Wednesday. With 78% of infections in the country mild, hospital-based isolation facilities will be preserved for those severely hit by the novel coronavirus. Speaking at Afya House, Nairobi on Wednesday, Health CAS Dr. Rashid Aman said the supervision of the implementation of the 22-page guidelines shall be done under the supervision of medical and public health officials.
While the World Health Organization recommends that all laboratory confirmed cases of COVID-19 be isolated and cared for in a healthcare facility, it also recognizes that not all cases can be cared for in a health facility when the numbers begin to rise.
However, for a patient to qualify for home-based healthcare, he or she is expected to have been confirmed first as COVID-19 positive at a laboratory. He or she should display only mild symptoms, have no pre-existing medical conditions, and have access to a suitable space at home. Whether the residential setting is suitable for offering such care to a patient will depend on availability of appropriate caregivers, separate bedroom, toilet, and bathroom facilities, availability of recommended personal protective equipment to both the caregivers and those infected, and capability to adhere to recommended precautions. The patient should be placed in a well-ventilated room and should have minimal interactions with other people, including caregivers. If the patient develops severe symptoms, they should call 719 and the caregivers further notify the designated healthcare worker. For symptomatic patients, the isolation should last at least 14 days and can be declared COVID-19 free if they do not display symptoms since they first tested positive. For the symptomatic cases, home-based isolation care can only end after 72 hours of no fever without using any fever-reducing medicine. The guideline has also introduced a digital monitoring system of patients dubbed the Jitenge system to monitor household contacts, the isolated patient, and the post-isolation discharged patient. According to Aman, community health volunteers will be the communication link between healthcare workers and the households for a period until one is declared COVID-19 free.
Home-based care in informal settlements, where households share small spaces, will require identification of institutions within the community, institutions that meet the recommendations for providing such care.
The patients will, however, have to fill a form outlining their eligibility for the program, with healthcare workers set to assess whether they meet the criteria. This as the country today recorded 105 new cases and 1 fatality. Now, with home-based care guidelines officially launched today, the country also recorded its first triple-figure tally of recoveries in a single day. David Mudoka for TV47 News Tonight, Nairobi.